start to reduce the teacher-student ratio in junior and senior high schools would be one of those. This will help to improve the test results that we're seeing. Even the minister himself lamented the test results in his report to parents, especially the 36% score in grade 8 math. My question to the minister is, when will we move to adopt the teacher-pupil ratios recommended in the Hogg report?
The Honourable Minister of Education.
Mr. Speaker, the government received the Hogg report back on, I believe it was December the 31st, 2004. We reviewed it. There were things in the Hogg report which the opinion, I think, of all who read it, there is some of the conclusions that he reached. It was better if they were discussed with the individual boards. And indeed, Mr. Speaker, I believe it's within 2 weeks that the meetings with the school boards to discuss the recommendations Mr. Hogg made will begin to take place.
The Honourable Member for Sackville-Cobequid.
Thank you, Mr. Speaker. It's somewhat ironic that the Department of Tourism is also responsible for preserving our history in our province, Mr. Speaker.
It is.
I say that because the minister doesn't seem to learn much from past mistakes. After the operations of the Blue Nose 2 were handed over in a secret sweetheart deal in the early 90s, Mr. Speaker, you would think this government might try a more open process, but they chose a different track. So my question to the Minister of Tourism and Culture, why did his department hand over the operation of the Blue Nose 2 to yet another society without the benefit of a public process?
Good question.
Honourable Minister of Tourism, Culture and Heritage.
Thank you very much, Mr. Speaker. And in fact, I popped into my boardroom earlier this morning, Mr. Speaker, and who did I meet but a former captain, Mr. Walters, of the Blue Nose, Mr. Speaker. I don't know if the member in the NDP caucus has a problem with Mr. Walters and those involved in the society, but if he does, feel free to speak up in the House, and I'll listen to what he has to say.
The Honourable Member for Sackville-Cobequid on your first supplementary.
That wasn't the question I asked the minister. If he wants to have comments like that, Mr. Speaker, nobody's questioning the integrity of the Lunenburg Marine Society, Mr. Speaker.
Relax, Michael.
It's the process we have a problem with, and the government doesn't understand this. The process that they go through to get this deal done, Mr. Speaker. The minister and his staff were treated behind closed doors, in secret, and announced out of the blue who would operate the Blue Nose 2. So I asked the Minister of Tourism and Heritage and Culture, where was the transparency in this process?
Right.
The Minister of Tourism, Culture and Heritage.
Well, Mr. Speaker, I don't know how much more transparent you could get dealing with part of our own Nova Scotia museum system, Mr. Speaker. That's part of the public system right here in Nova Scotia.
The Member for Sackville-Cobequid on your final supplementary.
Mr. Speaker, after the difficulties with trademark and lawsuits under the previous operation agreement, it's easy to understand why Nova Scotians are a little skeptical this time around, Mr. Speaker. So my final question to the minister, and I hope he'll answer it, will he commit to table in this House by the end of this session the full details of the agreement between the province and the Lunenburg Marine Museum Society for the operation of the Blue Nose 2 schooner?
Tourism, Culture and Heritage.
Mr. Speaker, in the very near future, Mr. Speaker, we'll be able to show the member and to show all Nova Scotians a document, Mr. Speaker, which will look at things such as the operations and the intellectual property, Mr. Speaker, and a number of different aspects, Mr. Speaker. And indeed, I believe the government has made the right choice with the Lunenburg Marine Society. I've heard nothing but positive comments, Mr. Speaker, and I have faith in what they are going to do for the Blue Nose and its sailing capacity.
Thank you. The Honourable Member for Cape Breton South.
Bring back some sense to Mr. Speaker, my question today is to the Minister of Community Services. Mr. Speaker, almost 3 years ago, the Federation of Foster Families requested adjustments to the per diem rates and maintenance rates since there had been no increase since 1999. Mr. Speaker, 2 years ago, the department responded, indicating that due to financial pressures, there would not be any increases in the per diem for fiscal years 2002, 2003, and 2003-2004. My question to the minister is, could the minister please indicate whether the request for a per diem increase for foster parents is still an active file in his department?
Order, please. Order, please. There's too much noise in the chamber. The Honourable Minister of Community Services.
Yes, thank you, Mr. Speaker, and thank the member opposite for his interest in foster parents. The Federation of Foster Families is a fine organization. It's been a delight to work with them. And indeed, we are working through the PRIDE program, which is a competency-based program. And as they take additional installments in that program, their competency per diem or monthly per diem goes up.
The Honourable Member of Cape Breton South on your first supplementary.
Mr. Speaker, it's the minister's interest in foster care that I'm interested in, not mine. Right now, my question, my first supplementary. The proposal provided to your department, Mr. Minister, almost 3 years ago included data from Stats Canada, which showed that the maintenance of a child costs about $45.72 a day, $25 more than the highest per diem rate for a foster child here in Nova Scotia. My first supplementary to the minister is, how can the minister justify a discrepancy when hundreds of foster parents throughout this province provide invaluable service to our young children?
The Honourable Minister of Community Services.
Yes, thank you, Mr. Speaker. And Mr. Speaker, I share that interest in working with the Federation of Foster Families. I meet with them a couple of times a year. Did so recently, along with staff, and we are working constructively with their board and their executive director to address the concerns that they are bringing forward.
The Honourable Member for Cape Breton South on your final supplementary.
Yes, Mr. Speaker, words are not what's needed here today. It's action that's needed from this minister, Mr. Speaker. At least in New Brunswick, Mr. Speaker, the Central Office of the Department of Health and Community Services reviews and adjusts foster care rates to take into account the annual cost of living on an annual basis. That does not happen, Mr. Speaker, in Nova Scotia. And my final supplementary to the minister is, could the minister please indicate when he anticipates having consultations with the agencies, the regions, and the Federation of Foster Families to specifically discuss per diem rates?
The Honourable Minister of Community Services.
Yes, thank you, Mr. Speaker. And in actual fact, the Deputy Minister is working with the foster families in reviewing their rates, and will continue to do so. And we look forward to a successful conclusion to this process.
The Honourable Member for Cape Breton West.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Education. Mr. Speaker, the Cape Breton Victoria District School Board has had preliminary discussions with the possible closure of the East Bay Elementary School and proposing to move the students from East Bay Elementary to Mountain View Elementary in Floral Heights subdivision. My question to the Minister, has the Minister or any officials within his department had or are they having any discussions with officials from the Cape Breton Victoria District School Board regarding the possible closure of the East Bay Elementary School?
The Honourable Minister of Education.
Mr. Speaker, as the honourable member would know, there was a rather lengthy and precise process for what would be school closures, and my department has not had any conversations with the Cape Breton Victoria School Board about the possible closure of East Bay Elementary.
The Honourable Member for Cape Breton West on your first supplementary.
Yes, thank you, Mr. Speaker. To date, the parents of the students attending East Bay Elementary School have not been afforded any opportunity to discuss this particular issue. In fact, I would suggest that perhaps they're not even aware of this possible closure. I would ask the minister if perhaps he would consult with the Cape Breton Victoria District School Board and assure the parents of students attending the East Bay Elementary School that they will be afforded an opportunity at a public meeting to discuss this issue.
The Honourable Minister of Education.
Mr. Speaker, earlier this afternoon I had the opportunity to seek some advice from my staff, and I'm advised that any school such as the East Bay would have to go through a public if closure was contemplated, then it would have to go through a public consultation process.
The Honourable Member for Cape Breton West on your final supplementary.
Thank you, Mr. Speaker. Mr. Speaker, the Cape Breton Victoria District School Board adopted a new policy on schools in their school board, similar to what happened in Halifax several years ago, and that is they have now classified the East Bay Elementary School as being part of a family of schools. In other words, East Bay Elementary and Mountain View Elementary are now considered to be one school. So, Mr. Speaker, my question to the minister, given his comments, would he consult with the school board and take that extra step and ensure, because this family of schools concept doesn't assure the residents, the parents, or the students any opportunity for this review process that he refers to, if he would, in fact, ensure that this public meeting will take place?
The Minister of Education.
I thank the honourable member for the question, and indeed, to be quite frank, there was some question about the relationship of the Mountain View School and the East Bay Elementary School, and actually as late as since my arrival in the House, I was advised that if any action was to be taken on East Bay, there would need to be public consultation.
The member for Cape Breton Nova.
Thank you, Mr. Speaker. Mr. Speaker, my question through you is for the Minister of Community Services. It's been nearly 3 years since the province signed a federal provincial affordable housing program. To date, only one project has been announced for Cape Breton, 20 units for seniors, non-elderly, single people in Sydney Mines. Mr. Speaker, I was at that announcement. Unfortunately, that project is on permanent hold while Cape Bretoners continue to wait for affordable housing. So my question to the Minister of Community Services, why hasn't his department stepped in to ensure low-income residents of Cape Breton have accessible, safe, affordable housing?
The Minister of Community Services.
Yes, thank you, Mr. Speaker. And Mr. Speaker, I want to start by acknowledging that the member has corrected a speech that he made earlier in this session where he said that there were no announcements in Cape Breton, and in actual fact, you have now announced there's in fact has been one, and I think if you checked Hansard, you will find that you said that there were none. So I appreciate his acknowledgement that we're trying to work with all parts of the province, and we look forward to more announcements.
Now, member for Cape Breton Nova, and your first supplementary.
Mr. Speaker, now you can see why this party did what we did yesterday to that minister over this foolishness, Mr. Speaker. And he knows that, Mr. Speaker. Mr. Speaker, the community groups in Cape Breton struggle just to stay alive and deliver core services in the wake of years of social programming cuts by the federal Liberals, Mr. Speaker. It is too much to expect them to initiate for funding. Mr. Speaker, people have to, non-profit organizations have to go out and sell things to affordable housing and do fundraising. Mr. Speaker, this government needs to show some leadership in developing affordable housing, accessible housing in Cape Breton. My question is to the Minister of Community Services. Why doesn't Cape Breton seem to appear on his radar?
Minister of Community Services.
Yes, thank you, Mr. Speaker. And Mr. Speaker, I would want to point out that there's more than announcements of new affordable housing projects for rental. We've got the home renovation program. There are other programs that are available, Mr. Speaker. Some of those have gone to Cape Breton, and I just want to say that I know the folks at the Community Action on Homelessness will be very pleased to see that the member has taken an interest in this, because they pointed out to me recently how disappointed they were with your party's position on affordable housing, and it was nowhere on your radar screen.
Member Cape Breton Nova, and your final supplementary.
Mr. Speaker, this minister stood in the House last year and said to this member that Cape Breton will receive its fair share. Well, we have 0 homes built in Cape Breton affordable housing. That's our fair share. Mr. Speaker, residents of Cape Breton need accessible affordable housing as much as anybody else. Some of the existing housing stock is in terrible condition, and there's a lack of affordable housing in key communities. My final question is to the minister. When will Cape Breton get its fair turn?
Minister of Community Services.
Well, thank you, Mr. Speaker. And Mr. Speaker, the honourable member seems to be a little confused, because one moment he's saying that they've got something, the next moment he's saying they got 0. So I'm not sure which one he means, Mr. Speaker. But, Mr. Speaker, I am pleased that the NDP is finally, under the leadership of their new leader, taking some interest in the people that are served by the Department of Community Services, because from the time he's become leader, it has not been a priority with that party.
The honourable member for Digby Annapolis.
Mr. Speaker, my question is for the Minister of Fisheries and Agriculture. Last year, during the close of the lobster season in LFA 34 in West and Southwest Nova, violence erupted because of illegal fishing. And this year's closing season is only 2.5 weeks away on May 31st. The season is closed for the future health and rebuilding of this fishery that is vital to this province. My question is, will the minister tell us what plans the province has in place and to ensure that this does not happen again during this closed season, which is close by?
The Honourable Minister of Human Resources.
Thank you, Mr. Speaker. What I can tell the honourable member on the other side, with the third party, is that what this minister and what this government has did and will continue to do is put more enforcement officers in that area to see that that problem doesn't arise again.
Honourable Member for Digby Annapolis on your first supplementary.
My question to the minister again, to the honourable member, to the soon-to-be third party across. Mr. Speaker, last year the province did nothing to ensure the safety of the fish stocks, or even the safety of people involved. Violence erupted in that area, and we don't want to see it happen again. My question to the minister, what is your government doing to ensure the illegal buy-in of any illegal caught lobster does not infringe on the conservation of this vital fishery?
Order, please. Time allotted for question period has expired. The Honourable Member for Dartmouth North on introduction.
Thank you, Mr. Speaker, and I want to thank the House for giving me the opportunity to do this introduction. Mr. Speaker, in the West Gallery, there is a person by the name of Terry Ann Lewis, who is a student from the province of Ontario, who's completing her degree in the School of Social Work at the Maritime School of Social Work. I also want to say that I am very pleased to say that Terry Ann Lewis has successfully completed her student placement in the office of the constituency of Dartmouth North, Mr. Speaker. So I would certainly hope that she will rise and receive the warm welcome of this House.
Welcome our guest to the gallery today, the Honourable Member for Cape Breton South on introduction.
Also in the West Gallery, Mr. Speaker, today two good friends of mine from Sydney, Iris and Gordy Gillespie, are with us today. I want to tell this House that Mr. Gillespie is a distinguished city firefighter for many, many years in the Sydney area. And I can tell you that also of interest, Mr. Speaker, is that Iris and Gordy's daughter, Jen, is a very valuable employee of our caucus office over here, and I want to ask them to stand and receive the warm welcome of the House today.
Exactly. Certainly welcome our special guest to the gallery today. It's Opposition Day, and I call upon the Honourable Member of Cole Harbour Eastern Passage for Opposition Member's business.
Thank you, Mr. Speaker. Can you please call Bill number 36, Medicare Protection Act?
Bill number 36, the Honourable Leader of the Official Opposition.
Well, thank you very much, Mr. Speaker. As you noted, for those in the gallery and for those of us here on the floor of the House, this is Opposition Day, and in that regard, we have chosen to call for debate this afternoon an act respecting the protection of Medicare in Nova Scotia. And I'm sure that the members opposite, the Speaker, and those here in the third party will understand that the reason why we have called this bill for debate today, Mr. Speaker, is because of some of the activity that we have witnessed in the province over the last number of weeks. And that, Mr. Speaker, is what appears to be a proposal coming forward from a number of different quarters for the setup and operation of private health clinics in this province, Mr. Speaker. And I wanted to just address for a moment, if I can. I know that many people who are here to listen to this debate will have already heard the Federal Minister of Health, Ujjal Dosanjh, and Roy Romano on CBC speak about the question of private clinics and indeed on the future of Medicare itself. And everyone, I believe, in this province understands that Mr. Romano led a very thoughtful and very in-depth clinic. I remember along with my colleagues, attending at the hearings here in Halifax, and at that time talking specifically about the health issues related to long-term care and the provision of health care to seniors in facilities, and how difficult it was in this province where, unlike other provinces, that health care was actually provided at a charge, and the fact that we felt that that was inappropriate. And Mr. Speaker, I don't have to go through the history of that with you. You well understand, the history of that and what actually happened in order to make it become resolved. So, but I did think there was one point that I think bears repeating, because it's the one we hear all the time, and we hear all the time out among the naysayers of the public health system, the argument that health care is just too expensive, that the people of Nova Scotia, for that matter, the people of Canada, can no longer afford to have a public health care system. And I think, Mr. Speaker, of all of the myths around Medicare and around the provision of the public health care system, that is the most dangerous. And I understand that the ministers of governments like our own have reason to want to justify their inability to be able to appropriately fund the healthcare system in this province. And I understand that they are struggling with very large debts, some of their own making, some not. I understand that there are cost pressures every day within that system, and that trying to find a reasonable balance is a hard thing to do. But, Mr. Speaker, that is not to say that health care spending in this country is out of control, because the facts speak quite differently, Mr. Speaker. The reality is, as Mr. Romano pointed out, about 9.7% of the GDP is actually spent in the provision of health care in this country. And over the years, that has fluctuated up and down a little bit, Mr. Speaker, by a percent or so. But, Mr. Speaker, if we look at other systems, and most particularly our neighbor to the south, what you will see is they spend some 16% of their GDP on the provision of health care services. And this is in a country where they have where public health care is in fact the exception. And for the most part, there are public health clinics in all of the states, I think, in one form or another, but they are there only to provide care to the most most destitute in many cases. I think the last statistics I saw, Mr. Speaker, was in that privately run Mecca down to the south, there were some 40 million Americans who didn't have health insurance, for whom access to health care could only be a matter of being able to purchase it, Mr. Speaker. And I reflect on my own experience in that regard. And I was in North Conway, as many people in Nova Scotia have been. We were down on a trip when my son was very small, and he developed a fever such that it was of great concern to me and my wife, so we went to the local hospital. And the hospital was a great new modern facility. It had a first-class emergency room, and the first thing you noticed when you walked through the door was that the emergency room was empty. There's nobody there, Mr. Speaker. And there was a window, and you went up to the window, and there was a person behind the window who, asked you what your difficulty was, and then they asked you, well, how are you going to pay for the service you require? And my own part, I had my MSI card, and I also had insurance that I had purchased knowing that I was going into the States, and I produced those, and at that point they agreed that they would provide me with the services that I required. And but what really struck me was that there was a sign on the window, and the sign on the window said, we have exhausted the the gratuitous health care budget for this year. If you would like to apply next year, please take an application form. And now I assume that they, like most people, have a fiscal year that runs from the end of April
through, or the 1st of April through around to the end of March. And what really startled me about it was that the date on the notice was the 1st of June. So anything that they were going to provide free of charge had been exhausted in their last fiscal year within 2 months of that year happening. Now, I can tell you, Mr. Speaker, the clinic provided excellent care. They provided excellent service. We got our test done quickly, and everything was quickly determined. But, Mr. Speaker, had I not been in a position to be able to pay for it, then I'm not sure what my alternatives were, and there was certainly no explanation as to where I might go. So, Mr. Speaker, an examination the world over through the Romano Commission came to the one fact which I think all of us can agree on. The one sure fact that we can all agree on, which is that Canada has the best healthcare system in the world. And Mr. Speaker, those of us who speak in favor of this bill today have in mind only one goal, and that is to ensure that the system, the medical care system that we have in this province, in this country, is properly protected. Because the reality is that those who would promote the culture of private clinics have foremost in their minds not the protection of the health of the citizens of the province or the country. They have foremost in their minds the ability to be able to generate income and profit for either themselves or their shareholders. Mr. Romano was very clear on the role that Medicare was to play in this country historically and today in the provision of medically necessary treatment. Mr. Speaker, and that is the focus of what the Medicare Protection Act does. It seeks to ensure that those services that are provided today through the Medicare system will continue to be wholly kept within the publicly funded system. And I'm not going to go through the tenets of the healthcare of the Canada Health Act, and we're all aware of the principles that are contained therein. But those principles, Mr. Speaker, are not just a trite repeating of values that existed long ago. The values that are contained within the Canada Health Act are the values of Canadians, and I believe that the values of the people of this province. And that's why we're seeking to try and protect them through the proclamation of the Medicare Protection Act, which would ensure that no medically necessary procedure would be performed outside of the public health care system. Mr. Speaker, Mr. Romano also addressed his mind to the whole question of the private clinics and the roles that they have traditionally played in this country and in this province, and he pointed out as he spoke on that question of what is medically necessary, and pointing out that there were procedures that were done that were non-medically necessary procedures that had traditionally been done outside of the system. And he also had a warning about those, because he warned people to understand that the proliferation of those clinics tended to take out of the public system expertise that was needed in the publicly funded system to provide the medically necessary services. So, Mr. Speaker, it's not as simple as just saying all of these services outside of the Medicare envelope are kind of harmless in their execution. They do come with a cost, and we understand that means drawing a line between the continued role of private clinics, because they have existed for some time, and the role of the publicly funded Medicare system. And we understand that that it's a very difficult line, Mr. Speaker, but it's one that must be drawn. We must commit ourselves as legislators in this province. I'm hopeful that the Minister of Health will stand up and talk about this and will say that the sole commitment of this government when it comes to the provision of health care in this province is to ensure the protection of the public good through the Medicare system within the principles of the Canada Health Act. I'm hoping that when the Minister of Health stands up to speak, as I'm sure he will on this, that what he will say to the people of Nova Scotia who are watching or those who are listening in the gallery is that he will support this piece of legislation because he understands it's important as a foundation value for the people of the province and the people of this country. And I would remind the Minister that it was, I believe, Robert Stanfield who brought forward the original Medicare plan for Nova Scotia, something that I think he was very proud of in his day and that the government of the day was very proud of. I would hope that the Minister would stand in defense of that system. Thank you.
Thank you. I recognize the Honourable Minister of Health.
Thank you very much, Mr. Speaker. I'm very pleased to rise and discuss the principles related to the bill that is before the House this afternoon. And I can tell the honourable member, Mr. Speaker, the Leader of the Opposition, that indeed I have a very keen interest in the time frame in which the Medicare was brought into this House, because my father represented Guysborough at that particular time, and he was one of the very strongest proponents of Medicare, along with Dr. Tom Gorman of Antigonish. The two of them collaborated to bring about support for Medicare in this province, and I can assure you, Mr. Speaker, if I were to act in a manner that did not protect the tenets of the Canada Health Act and Medicare in this province, I wouldn't be surprised that if the two of them would reach from the grave and get a hold of me. So Mr. Speaker, is where I stand with respect to this. Canadians and Nova Scotians care a great deal about how government manages their health care system. And for all provincial governments today, this is an ongoing issue, and I'd like to thank the honourable member for bringing it forward to discuss further. As I stand here today, Mr. Speaker, there is common ground among these elected members. And I know all of the members of this House believe that the Canada Health Act should be upheld. Mr. Speaker, I've said this before, and I will say it again, to ensure I'm very clearly understood. The government is committed to upholding the tenets of the Canada Health Act. This year, we will spend $2.6 billion to deliver health care in Nova Scotia. This is after having added an additional $218 million in new dollars this year alone. Mr. Speaker, all of this money is going to the public health system. We have added new programs and are sustaining existing services to which all Nova Scotians have equal access. We use this money for home care, long-term care, programs in our acute care hospitals, mental health, specialized equipment, new hospitals, for nurses, doctors, lab technicians, social workers, care coordinators, administrators, and therapists. Mr. Speaker, the $2.6 billion list goes on and on. This is a demonstration of how this government upholds the Canada Health Act. We have funded these programs and services so that Nova Scotians can access them when needed. Mr. Speaker, Canadians need to think about maintaining a public health care system that continues to require more and more funding, year after year. Demands on the system have never been so high, and these costs will be challenging to sustain. If we continue with current trends, then, Mr. Speaker, we know that there will be little money for other services in government. We need to address this issue as a province and as a nation. When we talk about sustainability, Mr. Speaker, 4 elements come to mind: funding our healthcare system, becoming a healthier population, looking at alternative ways of delivering care, and legislation. I can speak for a few minutes about funding our healthcare system. When we talk about a healthcare budget, it is obvious that this provincial government will do what it takes to put forward the dollars needed. But, Mr. Speaker, we need to see more participation from the federal government in healthcare funding. At last year's First Minister's meeting, there was some acknowledgement from the federal government that they needed to bring a bigger checkbook to the table. This led to more dollars, but, Mr. Speaker, it is still not enough. In managing the money allocated to health care, we are moving to become more efficient as budget managers, expecting balanced budgets from DHAs, ensuring people get the right level of care, whether it's home care versus acute care, self-managed care versus nursing home care, or community-based mental health services versus institutional beds. Policies for controlling escalating costs of drugs, implementing technology. PACS reduces travel for patients and reduces costs for film and supplies. Telehealth reduces travel for consults or business meetings. Hospital information system reduces duplication of tests and errors. Mr. Speaker, these are just some examples of how we are being good stewards of Nova Scotia's health care dollars and our commitment to funding a public health care system. Yet, when a person's health deteriorates, they are often unable to achieve these things. This government has taken proactive steps to address this area. We have set up a ministry solely focused on health promotion. Their goal is to give people the opportunity in their communities to make healthy choices in their lives, promoting kids' participation in sports, supporting recreational and sports facilities in communities, moving toward introducing 100% smoke-free legislation, healthy eating, preventing falls among seniors. These are just some examples of how we are supporting Nova Scotians. And over time, we will see less demand on the health system. But, Mr. Speaker, that will not occur overnight. Mr. Speaker, I now want to talk about new ways of delivering care. Nova Scotia has an excellent track record in introducing innovative health care. One example of how we are changing health care to meet the needs of our citizens is when we begin to integrate nurse practitioners into communities. Earlier in question period, the honourable member for Digby-Annapolis referred to the shortage of doctors in rural Nova Scotia. This is one of the things that, one of the methods by which that shortage is being addressed. We need to continue to explore options that serve Nova Scotians. And, Mr. Speaker, we will do that. Now, with respect to legislation, not only do we need to sustain health care funding, promote health among Nova Scotians, but we need to ensure that private health services do not erode our public health system. We cannot close the door on our options before the debate even begins. We have a responsibility to talk about delivery models of insured health services. But, Mr. Speaker, I want Nova Scotians to be very clear on this point. This government has no interest in contravening the Canada Health Act. We only have an interest in making sure Nova Scotians have equitable and universal access to safely delivered insured health care services today and in the future. Now, you may ask yourself, how can a private clinic in Halifax offer MRIs? These are insured services. Mr. Speaker, this clinic is a concern to us. We had no part in setting it up and do not want to see clinics begin to proliferate with no ground rules. And over the past year, Health Department staff members have been working with Health Canada to review this issue and will continue monitoring it. This is a very serious issue, and improving access to diagnostic equipment is a key element to a patient receiving timely treatment and care. And the legislation that we bring forward is legislation that needs to ensure that there is no queue jumping with respect to privately provided services and that those services are, meet the standards required for safe health care delivery. I'm pleased to remind Nova Scotians of this government's recent announcement of 6 new MRIs to address the access issue. And over the next year, we will introduce this service to 4 new sites around the province and replace 2 aging machines in Halifax. These will be provided in the public health system in our regional hospitals using public health dollars. Access will be improved, wait lists will go down, and treatments will be provided sooner. This investment is not unlike many others we are making to ensure our Nova Scotians have access to a high-quality, well-staffed public health care system. My department is now working on this legislation that will address many of the public's concerns about how health services are provided in the community. At the same time, the groundwork is being done, research being collected, and legal opinions being sought in order to pull a bill together. We are committed to ensuring that there is an adequate public and stakeholder consultation, and we hope to move forward with consultation before the end of the summer. This legislation is important to all Nova Scotians, and we need to make sure we take the necessary steps to have a well-informed bill. Mr. Speaker, I hope people understand that legislation is not the only solution. It is part of a puzzle, and this government is committed to putting the pieces together so that we have a sustainable health care system. Mr. Speaker, we must remember that in the provision of health care in this province, doctors are independent contractors. They can choose the province in which they work and have a great deal of autonomy from the government-run system. Some doctors are specialists and offer services that are not insured by the province. 2 examples that are being talked about these days include some cosmetic and dental surgeries. These services are paid for by the patient now, whether they are delivered in a hospital setting or a private clinic. So, Mr. Speaker, when there are challenges scheduling cancer surgeries or hip replacements and emergency surgeries in the public health system, the non-insured procedures fall to the bottom of the priority list. Nova Scotians would agree that this is the right way to manage OR rooms and other surgical resources. Yet often, we don't think about who ends up at the bottom of the list. We've heard that a few doctors are interested in controlling their own schedules. They plan to open a clinic in Dartmouth and perform non-insured day surgeries. Mr. Speaker, we need to work with doctors who are thinking about new and different ways of offering non-insured services to their clients. What we can do is develop well-informed and thoughtful legislation to ensure that they are performing appropriately. As mentioned, we will be seeking input from Nova Scotians on exactly what this legislation should look like. Mr. Speaker, healthcare workers are the cornerstone of our public health system. They offer high-quality professional care when Nova Scotians need it most. They are our most valuable asset, and as such, people have some concerns about the impact on our human resources when there is talk about private clinics opening. Mr. Speaker, I understand these concerns and share them too. Last week, I met with several members of the Nova Scotia Government and General Employees Union who represent thousands of healthcare workers in this province. My commitment to that group and to all Nova Scotians is that I will learn more about the plans for this clinic and keep them informed. We know that healthcare providers want to work in the public health system and that our contracted doctors have expressed their intent to meet their contractual obligations to the public health system. That being said, we have a continued interest in carefully monitoring any impact this and other clinics may have on our short supply of human resources. I commit to Nova Scotians that we will carefully examine any and all potential impacts on health care before moving forward on funding any insured service outside a hospital setting. And there are, Mr. Speaker, the technology of providing health care is changing very rapidly. And that means that what used to require a stay in hospital no longer requires a stay in hospital. So we believe insured services need to be delivered in a way that assures quality care, timely and equitable access, and patient safety. The issue of sustainability is not unique to Nova Scotia, so we must take action as a province to plan for the future. The Premier has encouraged more public debate and discussion on this issue, and I agree. So, Mr. Speaker, I will not support this bill, but promise Nova Scotians that I will bring forward legislation within a year that incorporates the views of our citizens and stakeholders. Mr. Speaker, I appreciate the opportunity to participate in this debate, and I want to reaffirm the commitment that I've made here this afternoon that this government supports the tenets of the Canada Health Act, and all actions taken with respect to the delivery of health care in Nova Scotia will be done under the tenets of the Canada Health Act and the principles espoused by it. Thank you, Mr. Speaker.
Thank you. I recognize the honourable member for Glace Bay.
Thank you, Mr. Speaker. Mr. Speaker, a pleasure to rise and debate today Bill number 36, the Medicare Protection Act. There's been a lot of debate, Mr. Speaker, that has surfaced over the past several weeks with respect to the private delivery of health care services in our province, and I would assume that this is probably the major reason why we're debating the bill today, because the health care system, Mr. Speaker, has grown to a point where it's about to totally collapse on itself. Mr. Speaker, there are many people, and I'm one of them, that believe that the inability of this government to manage the health care system is directly responsible for the sudden increase that we see in the creation of private health clinics or hospitals, whatever it is you want to call them today. And Mr. Speaker, one has to question whether there are greater plans on the part of this government to create even more private clinics. And that, perhaps, Mr. Speaker, was the reason for slashing the Provincial Health Council, if you recall, because the Act itself also has the Provincial Health Council as the body that would receive complaints, but that body no longer exists because that government canned it even after it begged to be reinstated, Mr. Speaker. But, Mr. Speaker, the whole issue of brought up by Bill number 36, the Medicare Protection Act, requires a full, informed public debate. Mr. Speaker, you'll recall that it was the Premier who once promised to fix health care for less than $46 million. I know that's a statement that has been said time and time and time again over the last 6 years in this legislature, but it was the Premier who said during an election campaign it would cost $46 million to fix health care. And we all know, Mr. Speaker, the end result has been over $1 billion, not 46 million, but over $1 billion later. And people, here we are, opening private surgical facilities in Nova Scotia. So obviously, it leads you to the conclusion that something is terribly wrong. Mr. Speaker, what is worse is that the government is admitting its failure by saying that the whole health budget is going to swallow up the provincial budget by the year 2025. Before that occurs, before 2025, Mr. Speaker, the healthcare system may itself become unsustainable. That is an unacceptable cop-out, Mr. Speaker, by this government. Mr. Speaker, everyone knows that the government failure. What they don't know, Mr. Speaker, I guess, is that perhaps, this is a bill brought forward by the leader of the official opposition, the leader of the New Democratic Party in Nova Scotia, Mr. Speaker. I'm wondering when the leader finally found out about this issue, and now that he's awakened enough to bring in the Medicare Protection Act, only if it was brought to the floor of this legislature by this party, the issue of private hospitals. It was the Liberal Party in Nova Scotia that made the minister aware of a third private hospital opening in this province, Mr. Speaker. The minister wasn't aware of the first one. It was the media that brought the second one to his attention, and we brought the third one to his attention. Mr. Speaker, the bill, for instance, in Section 7 of this proposed Medicare Protection Act, let me read it to you, Mr. Speaker. It says, "For greater certainty, but not so as to limit the generality of this Act, no privately owned health care facility operated for profit shall be permitted to operate in the province if it offers insured health services that are reasonably available through the health care insurance plan of the province." And I guess one of the questions that came to mind when I read that particular clause, Mr. Speaker, is exactly what the official opposition means by the word reasonably. It's rather vague. As a matter of fact, it's so vague you could drive a truck through it, Mr. Speaker. But the whole bill loses some meaning, I think, but it opens government up to allowing private services, which goes against the intention of the whole bill, which has left me wondering again. Mr. Speaker, you know, we need a new look at health in Nova Scotia. We need to take a system that will be there and ensure that it's going to be there in 25 years' time. It's going to require an open consultation across this province. And, Mr. Speaker, in order to do that, you need a plan. You need a plan for health care. It's something that this government has never provided us with. We've never had a plan. And I don't know, Mr. Speaker, if this bill is enough or is this is a poor substitute for that plan. We have to address the issue of sustainability. I agree. The Minister of Health, who just spoke before I stood in my place, Mr. Speaker, said both provincially and federally we have to address the issue of sustainability. We have to become innovative, he said, in ways of delivering health care and continue to explore options. Mr. Speaker, the examples of that by this government are few and far between. I would suggest what we need even furthermore is more of a common sense approach to health care in this province. And that's what we were told, Mr. Speaker. I've made reference to our Liberal Party roundtable on wait times that toured the province a year and a half ago, now with myself and my colleague from the riding of Kings West. Were the two members of the Liberal caucus on that roundtable, and we toured the province from Yarmouth to Sydney. We met with people, we heard their complaints. One of the common themes that we heard, of course, was the problems that we're experiencing with wait times in healthcare in Nova Scotia. And one of the other common themes that was repeated to us was one of healthcare now needs a common sense approach in Nova Scotia. Now, I know that's a rather vague statement when I say that, Mr. Speaker. I know that saying you should have a common sense approach to something could be misinterpreted as saying that's a cop-out as well. But I think what people were telling us is that there are things that are happening within the healthcare system that just don't make any sense. There's no common sense to them. And people think, people have come to the realization that, you know, you can guarantee delivery models of insured services, and you can say all the correct verbiage that you want. We have to have universal access. It has to be equitable access. We guarantee the tenets of the Canada Health Act and all of the above. But unless you have the resources, unless you have the common sense approach to back that up, those words mean absolutely nothing. I know those words mean nothing to people who are standing and waiting for ER rooms to open up, and the ER rooms that are down, you know, in my area that close on a regular basis in Glace Bay, in New Waterford, in the Strait area. They're closing at Soldiers Memorial Hospital, is closing an ER temporarily, And you know the first thing that comes to mind when those people, when the ERs close on a temporary basis is, could this possibly be permanent? It's temporary for now, but could we be looking at a permanent closure down the line because healthcare services are no longer sustainable? And Mr. Speaker, you know, let me say this to the government, and my leader, Francis McKenzie, has made this statement. And what he has said, Mr. Speaker, is that we cannot afford to continue to pour money into health care. You had an 11% increase last year. You have a 9.2% increase this year, and an expected increase next year. Under the former ministers of health, we had increases in health care. So what my leader said, Mr. Speaker, is where does it end? How can we continue to pour money into health care? But not once, and show me, Mr. Speaker, and I'll challenge every backbencher on the government side to show me where the leader of the Liberal Party said, take money from health care. Show me where it said that. Not only that, I'll provide all the backbenchers with all the bravado over there with the taped comments of the scrum that the leader was in. And you show me, let me hear in those taped comments where he said he was going to take the money from health care. You can't do it because it was never said, Mr. Speaker. It was never said what he said and what makes sense to every Nova Scotian. But it doesn't make sense to the members of government is that we cannot continue to pour money after money after hundreds and hundreds of millions of dollars into health care and not eventually come to an end. You cannot stand up during an election campaign in 1999 and say we'll fix health care for $46 million and then $1 billion later say we still haven't fixed the problem. With all of the money that you're going to get from Ottawa and all of the money you've received from Ottawa and all of the credit that you never gave to Ottawa for all of the money you received for health care, you still have not fixed the problems within the health care system. Now, Mr. Speaker, if that's not proof that this government is a failure, I don't know what it is. The Minister of Health stands up and says, you know, we've got brand new MRIs coming to Nova Scotia. The hospitals in Halifax are waiting to have outdated MRIs replaced. They're not included, but at the same time, other areas of this province, and I'm not denying any area of this province the proper equipment in health care, but other areas of this province are given MRIs and they do not have the staff to operate the equipment. Mr. Speaker, you would think a forward-thinking government would have said, do we have the staff to operate the equipment before we put it in place? You would think that those ideas would come to the government before they moved ahead. But that's not the case, Mr. Speaker. Not the case with this government. Which leads me, Mr. Speaker, to some final points that I'm going to make in the short time that I do have remaining here. As I said, Bill number 36, the Medicare Protection Act, is probably the reason we're debating it is because, and I'm not saying there are some bills that come before this legislature and are called in opposition days that are only there perhaps to cause some mischief. I'm not saying that this is the case with this act, Mr. Speaker, because let me tell you, in the first paragraphs of this act, it says, whereas the provision of public health care services under the Health Act is one of the most cherished accomplishments of Canada as a nation. No one could disagree with that, Mr. Speaker. No one would disagree with that. And it also says, and whereas it's desirable to entrench the principles of Medicare in order to protect them from erosion and to strengthen the principles by recognizing the need to prevent physical and mental health. And no one is arguing with those comments either, Mr. Speaker. But what we're saying as a caucus is that what's needed in this province, it's not part of this bill. What's needed in this province is a plan to bring some common sense to providing health care in this province, because if we don't, we won't have a health care system. The government has admitted to that it's going to take in 2025 I suggest it won't take that long. By 2025, we may not have a health care system to look after. We know how much it's eating up of the provincial budget, and we have the projections that it's going to continue to grow year after year after year. Mr. Speaker, it's time for this government to come up with a plan to open up, to publicly consult with anyone who possibly wants to be consulted on this subject, and to finally come up with a plan that we can have a sustainable health care system in this province, Mr. Speaker. That common sense approach that I'm talking about should always apply to government. Government is not up here and common sense down here. Of course, government can bring common sense to Nova Scotia if they wanted to, but for 6 years, Mr. Speaker, what we've seen from this government is health care budget continually to increase. That's all it does. We cannot look forward to that anymore. We cannot sustain it anymore. The government knows that. The government knows that this province won't generate enough revenue. Ottawa eventually, is not going to be able to supply you with the windfalls that they've been supplying you with in order to keep feeding what has become a health care monster. We can't do it. So, Mr. Speaker, we have to take a look, and we have to take a look, certainly not, as the bill says, as the NDP bill says, it says a cherished accomplishment in Canada as a nation, the Canada Health Act. We're not looking at doing anything to the Canada Health Act to subvert that in any way, shape, or form, Mr. Speaker. Thank you very much.
Thank you. I recognize the honourable member for Halifax Needham, and would the member allow for an introduction before you begin? Thank you. I'll recognize the honourable member for Timberley Prospect.
Thank you, Mr. Speaker, and I thank my colleague from Halifax Needham. I bring the member's attention to, well, one's a visitor, but the other's a regular in our West Gallery. I don't know whether you would recognize him out of uniform, but I know he has a friend with him today, and I would like them to stand in their place and receive recognition of the House. Matt Wynot can look good or bad out of uniform. It's nice to see you. And with Matt today is Charlotte Killen. Could you stand and recognize? Thank you.
Thank you. The honourable member for Halifax Needham.
Thank you very much, and I welcome our visitors in the gallery. I'm very pleased to have an opportunity to stand in my place and participate in this debate. I want to start, Mr. Chair, by reading a little quote as follows. The advent of Medicare gave my mother the one worry-free period of her adult life, a miraculous reprieve. Medicare has done more, much more than the provision of medical service for this country. It has transformed it from a rather cold, hard, negative society to the very pleasant one that we have been privileged to enjoy for the past few decades. The dismantling of Medicare may mean more than the loss of medical help. It may signal our return to the hard old ways of the 30s and 40s. And that the person who said this is B.L. Williamson from Ottawa, Ontario, and it's contained in a very excellent book called Life Before Medicare, Canadian Experiences. Mr. Speaker, I use that as a reference point into this debate for a reason. And I want to start by saying I do take some exception with the argument that was being made by the former speaker. I don't think it's at all helpful, Mr. Speaker, for any of us to stand in our places and argue that the system is about to collapse on itself. Mr. Speaker, this, in fact, I think is the hysteria of the right wing in this country that would frankly see Medicare dismantled because they claim it is not sustainable, and therefore people need to take either more personal responsibility, which is code for people who are better off being able to purchase private health care, and the development of a two-tier healthcare system in this country. And if anybody has read the recent study that was authored by former Ontario Premier Mike Harris and former Conservative Party leader Preston Manning, you will see quite clearly that this is the rationale that they base their argument that our public health care system is no longer sustainable and therefore we need to abandon it and in favor of a market-driven health care system. Mr. Speaker, we have serious problems in our public system, and the problems tend to be centered around the question of access to the public system. Wait times are too long, and timely treatment does not occur in the manner in which it should. But, Mr. Speaker, these are not problems that are insurmountable. They are problems that are fixable, and there are many very good studies that have indicated some of the initiatives that governments need to take to make this a reality, to make our system accessible in a timely fashion and keep it sustainable at the same time. Mr. Speaker, you know, I listened with great concern to the Premier the other day when he contributed to this hysteria by talking about the unsustainability of our healthcare system and citing the large growth in dollars into healthcare budgets over a short period of time. And what the public has got to remember, Mr. Speaker, and I guess we have to remind the public over and over again, that what actually occurred was the federal government in 1995, under the leadership of our current Prime Minister, who at that time was the Finance Minister, they reduced health care expenditures by the federal government by 20% over 3 years. They reduced the transfers to the province by 20% over 3 years. And so, yes, we are seeing a large increase in the dollars now because we are attempting to catch up to those years when we were starved for federal cash. And at the same time, here in Nova Scotia, we were seeing a reduction in federal transfers on other fronts as well, around education and social services. So I think we have to be very careful and not overstate the financial situation with respect to the sustainability of our healthcare system. We have to understand how it is that we got to the situation of having massive cash infusions. And Mr. Speaker, during those years when we saw the reduction in federal health care dollars, that meant we weren't buying the updated equipment. That meant that we allowed our infrastructure to deteriorate. That meant that our healthcare workers were overworked. They were demoralized. We lost people. We weren't able to hire people. We lost people who were already in the system. All of these problems that we are experiencing can be traced back to the federal government's decision in 1995 to balance the federal deficit on the backs of the provinces, and that's the reality. And at the time that that occurred, there were many people who said this would be the result, and indeed it has been the result. But let's not dwell too much on the past. I think we need to look at how do we move forward. And one of the ways that we can move forward, I think, is looking at some of the recommendations from Romano. In particular, we had a Royal Commission on the Future of Healthcare in this country, and the commissioner, Mr. Romano, made a recommendation that the Canada Health Act not only be upheld, but the Canada Health Act, in fact, be strengthened, that a sixth principle be added, and that be the principle of accountability, and that some of the ambiguity in the Canada Health Act with respect to diagnostic services as an insurable service outside of hospital settings be clarified, and that issues such as queue jumping and the differential treatment for people, whether they're workers' compensation clients or they're citizens at large with health care needs, that those issues be handled in a very focused and a timely manner. And I have to say I'm very disappointed that the federal government has not strengthened the Canada Health Act and has not dealt with those recommendations from the Romanow report. But let's look at the current government and the government's records here in Nova Scotia as well. I was quite surprised to hear the Minister of Health stand in his place today and make the statement that the private MRI clinic is of concern to his department. This, I believe, is the first time I have heard a member of the government say anything about the private MRI clinic that would lead the public in this province to understand that the government does, in fact, see this as a problem. In the 2.5 to 3 years that the private MRI has been operating, I know that I consistently, along with many other members of this caucus and health advocates, public health care advocates, members of the Nova Scotia Nurses Union, the Government Employees and General Workers Union, the CUPE, many of the groups that represent healthcare workers have expressed their sincere and grave concerns about the operation of the private MRI clinic. And it's taken 2.5 to 3 years to get a member of this government to say that they are concerned. But Mr. Speaker, what do they do about that? Being concerned isn't enough. Here in the estimates earlier this week on health estimates, I asked the Minister of Health how many people in his department were tasked with the responsibility to examine and analyze and track the privatization of health care in the province of Nova Scotia. And I was really quite surprised and very disappointed to learn that there isn't anybody in the Department of Health who has that individual task, very specifically well-defined job. Now, I would think if this government were concerned about the private MRI, and they have received correspondence from the federal Minister of Health indicating that the federal government is concerned that the presence of the private MRI clinic, for example, is possibly operating in a manner that it contravenes the Canada Health Act, which we have to recognize places our federal health care transfer dollars in some jeopardy, that this minister would not have and would not be sure that there were at least one person in his department who has the dedicated task of keeping track of the privatization of health care, of the difficulties between the ambiguity sometimes between what is an insured service and an uninsured service, and what this means for the potential jeopardizing of federal health care money to this province. I would like to believe that now, given the concerns that have been expressed and given the new developments, particularly the fact that we have a ophthalmologist who is opening a private clinic and is talking about doing insurable surgeries in his clinic with the full support and participation of our public health care system, that the minister would not drag his feet and would act quickly to deal with this. I also think that people have been quite disturbed to learn about clauses in the collective agreement between Doctors Nova Scotia, the Medical Society, and physicians that would allow for the establishment of a working group between the government and the Medical Society to examine the possibility of alternative delivery models for public health care that aren't necessarily going to be delivered in a not-for-profit framework. And Mr. Speaker, we have enough, or Madam Speaker, we have enough private health care in our province. Roy Romano has indicated that it is time for governments across this country to not only reaffirm their commitment to the Canada Health Act and expand the Canada Health Act, but in fact we should expand the kinds of insurable health care services that are currently not included in the Canada Health Care Act. And we need to be looking at home care, and we need to be looking at prescription drugs. I mean, these services now are so fundamentally a part of health care delivery and the Medicare, what people require to either stay healthy or to deal with illness, that it's high time we do this. I welcome, and members of this caucus certainly welcome, any public debate that occurs on the delivery and expansion of public health care in this province. We will look forward to participating in this debate.
The honourable member from Eastern Shore.
Yes, thank you, Madam Speaker. With the concurrence of the House, I would ask permission to revert back to daily routine.
Is it agreed?
Agreed. Yes, Madam Speaker, I would ask that you would call presenting reports of committees.
Call for presentation of reports from committees.
Madam Speaker, as Deputy House Leader, I'm asked to direct that the Committee of Law Amendments has met and has considered the following bills. Bills number 153, an act to amend Chapter 376 of the revised statute 1989, the Public Service Act, to establish the Office of Immigration. Bill number 168, an act to amend Chapter 418 of the revised statute 1989, the Securities Act, and also Bill number 173, an act respecting the bee industry. The committee recommends these bills to the favorable consideration of the House without amendments.
Is it agreed? Agreed.
Thank you.
Thank you. The honourable member from Cape Breton Centre.
Thank you, Madam Speaker. Call Bill 194, please.
Bill 194.
Thank you, Madam Speaker. I want to open my debate today with a line, Ms. Speaker. And it goes, Daddy, won't you take me back to Muhlenberg County, down by the Green River, where paradise lies? Well, I'm sorry, my son, but you're too late in asking. Mr. Peabody's coal train has hauled it away. Mr. Speaker, Madam Speaker, that's a couple of lines from a prolific songwriter from Chicago by the name of John Prine, whose family grew up in western Kentucky, an area rich, as many parts of Cape Breton are, in coal mining. But when John moved with his family to the south side of Chicago at a young age and would go back to western Kentucky, more and more of this great historic part of that great state was being stripped away by strip mining, Madam Speaker. And that's why we're here today debating Bill 193. 194, Madam Speaker, is about the reality of what strip mining does to a community. Now, the government has talked about giving exploration to many companies and allowing what they're calling is reclamation of sites. Now, if you were to take them on their word, you would assume these sites are recently worked sites, that they're sites that are covered with debris and so on. But it's not the case, Madam Speaker. These are areas that haven't been mined for 50, 60, 70 years. These are areas that are in very sensitive ecological settings. Yet government is telling us we need this resource. Well, you know, Madam Speaker, they're about the only ones that think that we have to go in after this resource. Community after community after community have told us, and have told this government, that no, we don't want it. That it will ruin a way of life. The problem with this is government isn't listening, and that's why we have Bill 194 in front of us. We need to protect what we have left in our areas, Madam Speaker. We need to take places like McCaskill's Brook in the Port Morion area and say, you know what, this is too great a resource to be tampered with for a few dollars. It very seldom generates many meaningful jobs. There's really no royalties given to the province by it. And any of these people that tell you that they'll come back and reclaim this land just can't be believed, Madam Speaker. All we have to do is look at the area of St. Rose. That area has been devastated by surface mining. Now, they changed the idea. It used to be called strip mining, so they want to call it surface mining to make it more palatable. But it is strip mining. That back of the old St. Rose mine is not only an ecological disaster, but I would say it's a safety one because of access by children. That's the type, and there are some of the companies that want to go in and strip mine in Cape Breton. So that's a problem. All we have to do, Madam Speaker, is on our way up here, many of us drive past the Stellarton exit in Pictou County, and we see this huge mound on the skyline, and what it is, it's Pioneer Coal's strip mine. And, you know, it looks like something from a disaster film. Do we want that in Cape Breton? Absolutely not. We see that there's certain tracts being looked at in my home community of New Waterford that will go right next to our watershed. Right next to the watershed. Just after we've had just averted a disaster with the former Cape Breton Development Corporation when they put a tailings pond out by there to get rid of some of the excess from mining at their coal prep plant. So, you know, this stuff just doesn't work. Nobody wants it. And why all of a sudden is government rushing to do this? It bothers not only myself, but members of these communities. Many of them, you know, they're not, these people that are out there trying to stop this aren't what government would like to portray as these wide-eyed environmentalists. You know what they are? They're school teachers. They're former coal miners. They're retired armed forces people. They run the whole gambit, Madam Speaker, of community citizens that are concerned. But the only group that doesn't seem to be concerned is government. Government just says, you know, take Mr. Peabody's crane and just take it away. Just clear it away. We got nothing left for you. For whose benefit? Is it the benefit of the inshore fishery in Port Morion? No. Absolutely not. An industry that sustained us for over 100 years. Port Morion, the very site of the first underground coal mine in North America. So these people aren't your wide-eyed environmentalist who says, no expansion at any cost. No, Madam Speaker, there are people from their community who says, this is important, this is way too important to future generations for a few quick dollars. And this is felt in other parts of my constituency, Madam Speaker. It's the Gardner area. All you got to do is look at that reclamation site they did at the mess they made on Centerville Road, the mess they made at the reclamation project up at the summit. These are all areas that look like it was used for nuclear testing. They seeded it, and it lasted for a couple of years, but it was gone because there wasn't enough earth to sustain it, not enough soil. Then we're now looking at Bullindry in that area and the former Prince Mine site. And they're telling us, no, don't worry. We're going to make this pristine. Well, all you have to do is take the Prince Mine Road up the Prince Mine, Madam Chair, and see the devastation along the road, what former strip mining has done there. So, Madam Speaker, it looks like, again, like a nuclear waste site. Yet, government after government after government, Mr. Speaker, is not doing what they should be doing to protect that environment. What we have to do, Madam Chair, is to stop this. Do like this bill asks, have a moratorium. Allow the residents of the area to voice their opinion in a reasonable, rational way. You ask to the people from Morion, they'll tell you. You know, they've lived it all their lives. The people up back in Broughton, they know the difference, Madam Speaker. They know the difference. The people up in Bullendry who fought putting Point of Coney power plant where it is, they know what it's going to cost their community, Madam Chair, Madam Speaker. So these are items that we need to put together now in legislation. We have to have a moratorium on strip mining. It's not about progress. If they want to get Cape Breton coal, go to Donkin. Go underground, the portals are there, dig it up, hurry along, government, I say to them, hurry along and do Donkin. But do not, in any way, shape, or form, do strip mining in Cape Breton. Nobody wants it, nobody gains by it, Madam Speaker, everybody loses. The only winner is a few rich people like the Chisholms, and we don't want to see them get rich at the expense of the ecology of Cape Breton Island. Cape Breton Island has paid too great a price for too long a time, fueling the fires of this province and the industry and the power plants. Stop strip mining and stop it today, Madam Speaker. Thank you very much.
The honourable member from the Eastern Shore.
Yes, thank you, Madam Speaker. I rise in my seat today to bring some remarks from the Minister, the Honourable Richard Hurlbert. But before I do that, I would like to speak to my colleague across the floor and tell him that I understand what he speaks of, maybe in a different capacity, but I certainly understand a member wanting to represent his constituents. Not different than any other one in here, I've also been approached with many challenges on the Eastern Shore. And I'm going to bring attention to something that's very near and dear to my heart, and that's the work that I've done with the Ship Harbour Long Lake area. Now, Madam Speaker, that is not a coal mining or strip mining production, but nevertheless, it is about a resource in which industry wants to capture, a resource in which industry wants to harvest and bring opportunities to the people of the Eastern Shore. But in saying that, I believe that the rule of thumb, or what we think that industry wishes to come in, wishes to harvest all, wishes to gain the most profit for the shareholders, and in doing that, create opportunities and benefits for their employees. But we have to talk about balance here. We have to talk about plans. We have to talk about input. We have to talk about government, industry, and most important, community input. Community input is very important, Madam Speaker, because it's the people who are going to gain or lose by harvesting the fiber or resource of the industry's challenge. So in saying that, I do respect the member. I understand that this issue today is about listening, about understanding, about working together. It's about government, once again, industry, and the community creating a balance. And Madam Speaker, I believe speaking with the Minister, both the Minister of the Environment and also the Minister of Natural Resources, that the intent of government is to go to the island, the beautiful island of Cape Breton, and to talk and to do particular studies. They've assured me, Madam Speaker, that these things are in line, or I wouldn't stand in my place today and promote any type of industry moving into an area that was not going to be to the favor or not going to have a certain structure in place. So at the end of the day, I should hope that the department and industry and also the community can come to an agreement on this issue. And I'm pleased that the member stands in his place and represents his people. But in saying that, I would like to take this opportunity to read a few of the minister's comments. And it goes like this, Madam Speaker. Cape Breton still has a significant coal resource, resource that can provide important economic benefits to their community. Our efforts to make these coal blocks available to the private sector reflects the government's commitment to develop these resources in a responsible way. Now, Madam Speaker, as I said earlier, the resources in a responsible way. That is the issue. It is a commitment we've made to Nova Scotians in our energy strategy, seizing the opportunity. Under our government's watch, these resources will only be developed by the private sector and only by companies with sound management and financial means of doing so. So, Madam Speaker, we're not going to, I guess, permit any industry to come in and to just cut the resource down without providing sound management. In return, Cape Breton residents will benefit from the economic opportunities these operations present. Now, we know in most parts of rural Nova Scotia, Madam Speaker, that there are many communities that need job opportunities. And once again, going back to what I said, it's good to have a job opportunity as long as that balance is there. The potential for surface coal mining in Cape Breton by the way of the private sector is an important means of providing jobs for residents in the area and for generating royalty revenues, once again, Madam Speaker. It is also a critical avenue for correcting damage caused from past mining activities without using public funds and for restoring lands for other public uses. If permitted to proceed, here's the key sentence, members, if permitted to proceed, the private sector will generate employment in both the mining and supply sectors. While the job numbers may not mirror DevGo days, several million tons of coal presents a significant economic opportunity. Madam Speaker, I want my honourable colleagues to understand that the government will not sacrifice anyone's health or the water supplies to seize these opportunities. As I said, before I would stand in my place and read the notes, I had conversation with the minister, and they assured me, Madam Speaker, that these things would be looked into. The Department of Environment and Labour will engage, as they do, with all proposals of this nature in an environmental assessment as provided under the Environment Act. Successful companies will be subject to all rules and regulations of the province. So once again, Madam Speaker, they're going to put these policies in place, and they're going to regulate, they're going to watch over, and they've made a promise, Madam Speaker, not to violate the rights of the community. This bill would prohibit a lot more than surface of coal mining on the island if passed in its manner. It also would eliminate existing operations for many other commodities. Commodities, Madam Speaker, that hold great current value and tremendous potential for our future economic development in an area of the province most deserving. So the bill that has been presented in the form does not zero in on just strip mining in Cape Breton, which I believe was the caucus's intent, but also will affect all other mining operations, Madam Speaker, in Nova Scotia, right down to I understand that would even include quarries and also small mining operations, or to some degree. So I think the bill went a little astray, because it is important that we do have our quarries as long as they're managed, and our pits as long as they're managed. So I speak once again of community involvement. I speak about the government's involvement. I speak about industry and the balance there. So I think the mechanism will work. This bill would effectively limit the growth of existing gypsum operations in Milford and the Little Narrows, potentially costing more than 200 jobs. And we have to be very careful of that. The power of a bill is very important. We can pass a bill here without quite understanding the effect of all others of the province. So I think it's incumbent upon us to be able to read and to debate and to understand any bill that's put forward in the People's House. Madam Speaker, we have a quarry in River Denny. would also be negatively impacted if this bill is passed. And I can go on and go on and go on, and I know that you don't want me to continue to mention the different areas that will be affected, but I think it's responsible of me to stand up and say, and to say that this bill would cause some jobs. But once again, going back, it's not the intent, I don't think, of anyone to bring issue with this, to take anybody's livelihood away or to take anyone's job away. I think the intent of this bill is to bring awareness and also to make sure that the government is listening to the people of Cape Breton. I'm sure the intent of this bill was to make sure that they're sending the message to government and say that, make sure you police your regulations, make sure you have your community input, and make sure that everything is, once again, is a balance. I believe as Nova Scotians that we must live in a balanced province, Madam Speaker. As I said clearly before I take my seat, I have supported the Ship Harbour Long Lake in a very aggressive manner, and I would not want someone to come down and to cut the Ship Harbour Long Lake without a plan, Madam Speaker. So, Madam Speaker, my time is running short. I believe I have less than a minute, but I hope that I've brought some relief to the author of this bill. I hope I've explained to the caucus that the government is concerned, aware, and certainly understands this bill. Thank you, Madam Speaker.
Thank you. The honourable member from Kings West.
Thank you, Madam Speaker. Certainly, it is indeed. I'm very pleased, in fact, to be able to rise on this bill. It's a very important issue, and I would like to commend the member for bringing this bill forward because it does have some merit for discussion. And the question, however, that I would pose and our caucus would pose is whether a bill is necessary. And there are three things that I think we need to establish very clearly that the NDP bill is proposing. Now, first, it would halt the development of a new or expansion of existing strip mines in Cape Breton immediately upon the passage of the bill. So that would have that kind of immediacy and an impact that would be very, very far-reaching. Second, it would require that the Minister of Natural Resources to conduct public hearings with residents of the areas where new or expanded strip mines are proposed. And the third part of the bill is that public hearings must be conducted within 6 months of the passage of the bill and a report filed with the legislature after the hearings. Now, Madam Speaker, if this bill has merit, and I think this is a key point that I'd like to make and establish, if the bill has merit, then it should be a bill that applies to all of Nova Scotia. That would be one of the key arguments that I would indeed present. There are strip mines in several locations, and of course we also have the possibility of others in the future. And certainly we know that public consultation on these matters must in fact be part of the process, and consultation also needs to be opened up to industry and all stakeholders who are involved with strip mines. We know that one of the areas of the province where perhaps the greatest consultation was not carried out was the quarry proposal for Digby Neck. And we know that people came forward then and continue to come forward with their concerns. And we certainly know that tourism and just the natural beauty of the province should not be put on the line when strip mining is being proposed. More importantly, I'd like to see legislation that ensures these sites are remediated back to the pristine condition when they are finished. We know that that has been a condition in a few of the strip mining operations that have taken place in the province, but however, it is not there in a wholesale manner. And we know this can be done. It is done in many provinces. A number of the U.S. states now, if you're going to strip mine, especially for coal, this is in fact one of the contractual requirements, and the cost of the resource is factored in to the remediation of the site. So this certainly is one of the aspects, again, that we would like to have as certainly part of any bill, any legislation in regards to strip mine. It is interesting, Madam Speaker, that back in 1998, the member from Cumberland South, our current Speaker, introduced an act to prohibit strip mining in the town of Spring Hill. And that, of course, bill did not pass. And I think due to the very serious limitations of this bill, I'm also feel that probably it will not pass, because I believe in a provincial approach to such an important topic. So I think a long-term policy of sustainability, as opposed to bills that just apply to one particular region or area of the province, is really a very, very limited scope. Strip mining may be appropriate in some areas, but not in others. And that must be addressed by government in a stronger fashion and a better mechanism than we have seen in the past. So what this bill is doing is drawing us to take a serious look at where we are with strip mining and where we're going to go in the future. And I think, as the member opposite pointed out, a balanced approach is the one that we are going to absolutely need as we go forward in this area. And in fact, to that end, my colleague from Victoria to Lakes sent a letter to the minister and asked some very, very strong questions about the strip mining going on and proposed in his area. And I would like to draw the attention of the House to a few of those questions that the member from Victoria to Lakes proposed.
The honourable member from Cape Breton West.
Yes, Madam Speaker. I was wondering if the honourable member would entertain a very short question. I need some clarification on a couple of points you made, if he would be willing to answer.
Would the honourable member from Kings West entertain a question?
Perhaps when I finish, Madam Chair, because I did want to continue the letter and the intent of where I was going here.
Right. Continue, the honourable member from Kings West.
And the questions that the member from Victoria to Lakes proposed to the minister are outlined in this fashion. What are the official stages a company must follow in order to begin such mining? What precautions are in place in the event that a resident is negatively impacted by the mining? And we all know that the issues around water supply are one of the biggest ones when it comes to strip mining. And while there isn't strip mining, for example, in my riding, there are sand pit operations, and that very question around water supply comes into question. And I asked the Minister of the Environment and Labour during estimates about that very fact of when the Department of the Environment gives permits and so on for sand pit development. And he did point out that while there is a strong assessment done, he does feel that his department perhaps doesn't have the resources to continue to monitor and follow up to make sure that that the supply of water of local residents and so on is protected. Another question was, what examples can your office provide of reclamation mining in the province by the same companies currently involved in the Victoria of the Lakes? Is it the current intention to allow these contracts to proceed if all necessary steps by the companies involved are followed? And the last question that he asked the minister to deal with, are members from your office available to my constituents directly if additional questions or concerns arise? And I would like to table that letter in the House so that it can be there for the record. And just to finish up, I think the long-term policy of sustainability, as opposed to a bill affecting just Cape Breton, is where the province and where we as legislators need to go. Because clearly strip mining on certainly some small-scale operations have been accomplished, have been carried out very successfully in some parts of the province. And I think there is an example in the Pictou area of a recent strip mine, and then reclamation of the area, certainly to the satisfaction of local residents. So I would like to end off by saying if we want to protect our natural beauty, we must ensure that we protect areas that need to be protected, but also ensure that those areas scheduled for development must also be improved when development activity ends. And I would entertain a question.
The honourable member from Cape Breton West on question.
Thank you, Madam Speaker, and I do thank the honourable member for entertaining this question. I'm just kind of receiving some mixed signals here about the sense of purpose for the bill before the House, as the members raised at his opening remarks, and then went on to do the pros and cons of the issue. I need to know specifically, is it the Liberal caucus position, or the party position, to support strip mining in Nova Scotia, given all the parameters that he outlined?
The honourable member from Kings West.
What our position, as I stated today very clearly, is that we will take a balanced position where there will be occasions when strip mining will be feasible, when full environmental assessments are carried out, the residents are satisfied with those with the process that will go forward. There will be some areas where strip mining will be turned down because of wide consultation with everybody. There's simply, again, this bill doesn't really take us into the global picture of the province. This is really Cape Breton, although I have alluded to a provincial position that our party would like to see, and that is some development, but always with very strong and stringent guidelines.
The honourable member from Hants East.
Thank you, Madam Chair, and I thank the member from Kings West for the 3 or 4 seconds of his time that I got. Well, some interesting comments, and I should make my comments, I think, as close to the bill as I can. And if I have any time, I'll address some issues raised by some of the other members. The idea that that this type of action doesn't necessarily have to come by way of a bill. Well, common sense should tell us as legislators that that's true. I mean, the government has the right to set policy. The minister in his department can set policy around strip mining and doesn't have to bring in an act to do that, at least in most cases, to my understanding. So it would seem that in terms of the opposition, we don't get to write much government policy on this side of the House. So therefore, to raise the issue, try to get agreement from the government members, and to see if the government's interested in either calling our legislation or drafting their own legislation along similar lines, something that we could accept. This is a good way to raise the issue. Now, I'm surprised. I mean, the Act, number one, deals with Cape Breton. And the member for Eastern Shore spoke for the minister and spoke for himself, I think, to a degree. Mentioned about the mine. I think he must have meant Melford, I think. Did he? He said Milford. Melford. Okay, thank you. I was going to say Milford wouldn't be affected. And I think the people of Cape Breton, who are represented by certainly a number of members on the Liberal caucus and a couple of members in the Tory caucus, I think that the people who have approached us would be very pleased if this bill deals with Cape Breton. If the Liberal Party wants to draft other legislation deals with the whole province and addresses this issue in Cape Breton, we'd be really happy to have a look at that. That's not a problem. So, but the issue presently is Cape Breton, and it makes perfect sense to us to have a bill that addresses this issue in Cape Breton. And what this hopefully would do is put a moratorium on both expansion and creation of new mining operations, and allow 6 months for the minister to actually consult. And I have to say, on both sides of the House, I heard, I think, a lot of fence sitting. Yeah, if it's done this way, if it's done that way, then we kind of agree, and we think there are jobs, but I think what members want to try to remember, and I think certainly the members on the government side, and I don't think I should lay this at the feet of the members of the Liberal Party, because they didn't say it, but the members on the government side, it was the Premier who in 2003, and actually maybe even as back as far as 99, said let communities decide. It was a whole range of issues from mining to aquaculture, that the Premier said let communities decide. Well, I got to say, the Premier hasn't really lived up to that statement in a big way in his term in this House as Premier. And I have to say, for us, this is the matter, that communities don't want these activities, and they shouldn't have to be made to bear them. Now, the proponent, they can come in, take the coal, sell it wherever, and the member from Kings West, he raised a good point, actually, around the issue of reclamation, but that hasn't happened. And actually, even in the Pictou case, there's no evidence from the people there that they're pleased with the reclamation. My colleague from Cape Breton Centre, he mentioned that some of these areas haven't been mined for 50 and 60 years. Well, then I'm assuming, he said they're ecologically sensitive, and some of these areas, if they were impacted years before, but you'd have to assume that there are ponds and bogs and woods and whatever after 60 years, and this is not going into a an open field or a gravelly area or whatever in a lot of these cases, and you're not going to pull the machinery out, push a little soil around and maybe plant a few trees and say that's as good as it was when we got here. That's not going to be the case. The member from Eastern Shore, I guess if you say something long enough, maybe you can make people believe it. And his point about Ship Harbour Long Lake, he's a member of a Tory government that has not protected Ship Harbour Long Lake, has not protected it. And every now and then, you can kind of get tired of this, sanctimonious, we're great guys, but we're ripping, everything out of this province, exploiting it, and think, if I can get both hands and pat myself on the back, I'm going to do it. You have to at some point recognize what you're saying and what you're doing are in conflict. And that's what's happening with this government.
Sure.
Thank you, Madam Speaker. Would you take a question, please?
Would the honourable member from Hantseys take a question? The honourable member from Eastern Shore.
Thank you, Madam Speaker. I'm a little confused with the emotion that's been shown through the member across the way. I want to bring it a little bit more personal. Is the member across the way stating that the member from the Eastern Shore has not worked to bring positive results to the Ship Harbour Long Lake? I would ask him to come clear with that, and clearly say, has the member worked for the Ship Harbour Long Lake, or has he not? I want to ask that question.
The honourable member from Hantseys.
Brought positive results. I say no, he has not. That was your question. Now, I, as yet, am not able to understand, since 1999, actually might as well say since 1998, because the Liberals were no different, why it is that they will ignore the concerns of people in their homes where they live who cannot pull up stakes and move because of some activity that the government has allowed in their area that they've indicated that they do not want, and no, will not entertain a question.
The honourable member from Eastern Shore.
Madam Speaker, I don't know what's gone wrong in this House here this afternoon, but certainly something clearly has taken place. The point of order is that member did not answer the question from the member of the Eastern Shore. My question to that member was clearly, has the member from the Eastern Shore not worked towards positive results to Ship Harbour Long Lake, Madam Speaker?
Order. It's not a point of order, and you maybe can continue your conflict out later on.
Thank you.
The honourable member from Hants East.
Thank you, Madam Speaker, and perhaps the member from Eastern Shore should recognize there's a difference between answering a question and getting an answer he doesn't like. So.
Come on.
The honourable member from Eastern Shore.
Point of order. If the good member is not able to answer that question, I suggest he should call the Member of Parliament, Peter Stauffer, and ask him the question, because I have been congratulated by Peter Stauffer on the work trying to save and to protect the beauty of the Ship Harbour Long Lake, understanding and recognizing the attributes
Order.
of that land, the people of the Eastern Shore.
The honourable member from Hants East.
If I could stand in my place. Well, the honourable member made this statement here today. I wouldn't want someone to cut Ship Harbour Long Lake without a plan. Well, to me, the plan would be don't cut it, and I haven't heard you stand up and say that. Thank you, Madam Speaker.
Time is up. Government House Leader.
Yes, thank you, Madam Speaker. I move the House to now rise to meet again tomorrow at the hour of 12 noon. The House will sit from 12 noon until 8. Following the daily routine and question period, we'll go into committee of the whole House on supply and continue on with supply for 4 hours. And then, Mr. Speaker, we'll take up public bills for second reading. And, Mr. Speaker, I'd like to bring to the attention of the House that it would be my intention tomorrow to call Bill 177, certainly for a little while, and to also call Bill 198, the Halifax Bridge Commission Act, and Bill 191, the Municipal Law Amendment Act, and the third one was the Workers' Compensation Act, which I believe was introduced today. It was not introduced today?
And the adoption.
No. Okay, well, yes, we may try the Securities Act. So with those words, Madam Speaker, I move the House to now rise.
Is it agreed? Now we've now reached the moment of interruption. And the resolution for late debate is, be it resolved that the 2005 Offshore Technology Conference, OTC, was a resounding success. The honourable member from Cape Breton North.
Thank you very much, Madam Speaker. It's a pleasure to rise here in my spot today to speak to the Offshore Technologies Conference for 2005 as it relates to Nova Scotia's presence in our growing and emerging oil and gas sector. Madam Speaker, as we move forward and now deal with the opportunities that lie ahead as a result of a resounding success achieved at Houston this year for Nova Scotian companies and indeed for all of our province, Mr. Speaker. I was very pleased to help lead the Nova Scotia delegation, a mission to Houston this year. This year, Mr. Speaker, we saw over 31 organizations from Nova Scotia join with the Department of Energy, as well as with OTANS, the Offshore Onshore Technologies Association of Nova Scotia, go down to Houston for this, the largest offshore oil and gas event in the world. Last year, Mr. Speaker, there were over 50,000 delegates participate in the OTC, it's as known. This year, Mr. Speaker, there were 65,000 delegates present for the Offshore Technologies Conference. Nova Scotia's presence there, with 31 organizations, with the province of Nova Scotia, with OTANs, and you consider the context of Nova Scotia's presence and participation with that, for instance, with another province in Canada of Alberta that had 30 participating organizations from that province. So it goes to show you the level of interest and indeed the level of activity that is now emerging and continue to be energized, so to speak, here in our offshore. Mr. Speaker, as you know, last year, Nova Scotia had to deal with certain realities associated with the natural cycle in the energy and the oil and gas sector, and that was dealing with forfeitures at the time and those revenues that came in, and the $55 million that did come in, Mr. Speaker, as you know, went towards the surplus of the budget for the province of Nova Scotia, and indeed that $55 million was applied against the debt of the province. But what we see in our offshore and positioning and why there was such momentum was the working efforts of this province and with industry, with other provinces and with the Government of Canada through the Atlantic Energy Roundtable in terms of efficiencies and regulatory processes and moving forward and trying to provide a better climate from lessons learned and looking at the history we've had with regards to our Cohasset Panook project, with the Sable project. We see the development potential of the Deep Panook project and the go-forward opportunity that it presents with tie-in to the Sable infrastructure, with tie-ins to that as well, and with the potential of developing the Annapolis well and